Good morning, everybody, and welcome to today's webinar, Succeeding in a Rapidly Evolving SNF Landscape with Real-Time Notifications. I'm Alex Fanko, the editor of Skilled Nursing News, and I'll be moderating today's chat, which is brought to you by PatientPing. Before we get into today's presentation, I just want to lay out a couple of ground rules. Number one, we want to make this as interactive as possible. So if you have any questions during the course of today's presentation, please feel free to submit them using the chat box on your right. We will collect those as the conversation goes on, and then at the end of today's presentation, we will have a question and answer session. Again, we want this to be interactive. We want this to be a back and forth. So if you have any questions, please feel free to ask them. I'll take a look at them, and I will make sure that we ask them toward the end of today's presentation. The other thing I want to make sure that everyone knows is that they will be receiving a recording of today's webinar presentation, as well as all of the slides. Take a look, be on the lookout for that in your inbox with the address that you used to sign up for today's presentation. You'll be receiving that directly from PatientPing. And now, without any further ado, I'd like to hand it over to today's presenters. Vanessa Kuhn, I believe you are first up. So Vanessa, take it away.
Great. Thank you so much, Alex, for the kind introduction. And then I'm excited to be part of today's webinar and discussion. If you can please move to the agenda slide. So thank you all again for joining and for taking time out of your busy schedules to participate. And I'd like to just review briefly the goals for today's webinar. We'll first provide some more context by giving a brief overview of the recent regulatory and reimbursement changes that are driving the need for more actionable real-time notifications. We'll also discuss how the lack of timely and complete data can amplify existing challenges for SNFs. And we'll then also highlight some key opportunities those real-time notifications can enable. And finally, we'll show how SNFs can use notifications for financial and operational success. And as Alex just mentioned, we'll have some time at the end for Q&A. So please feel free to put those questions into the chat box, and we'll monitor them as we go along. Next slide, please. So I'd like to start really by just setting the context for our discussion first. That really means looking at where the overall healthcare system is going, and then how that really impacts providers in the post-acute space, and in particular SNFs. As I'm sure you've seen over the last decade, really since the Affordable Care Act was passed, there's been a general movement to value-based care. That means changing payment arrangements, changes in reimbursement that move us from a fee-for-service system to a much more patient-centered and outcomes-focused approach. As the often referred to triple aim, value-based care is focused on achieving better health for patients and populations, and also delivering better care. So, for example, ensuring that patients get the right care at the right time. And then thirdly, lowering overall healthcare costs. In other words, really bending the cost curve in a downward trajectory. Many of the programs that CMS, and in particular its Innovation Center, has launched over the last several years have all focused on moving providers into more risk-based contracts. That means contracts that include a level of financial risk and require total cost of care management while achieving certain quality benchmarks. Examples of these include episode-based payments or bundle payment initiatives. Many of you might have participated in the former BPCI models that included post-acutes, or might be partnering with acute care hospitals on managing care for patients that are currently participating in the BPCI advanced model. There are also accountable care arrangements, for example, the Medicare Shared Savings Program, the Next Generation ACO, the comprehensive ESRD care models, and of course, there are many similar arrangements in the commercially insured space and also some in Medicaid. And to round out this admittedly non-exhaustive list, there are also other pay-for-performance type contracts based on attaining specific quality metrics. In particular, the pandemic has also highlighted even further how some value-based care arrangements can help ambulatory practices continue to operate even when volumes go way down because of the population and per patient payments that are not dependent on actual visit numbers. So in summary, really all of these models and the shift to more value-based care place significant emphasis on care coordination for providers across the entire continuum. really including all of the post-acute providers and suppliers. And really, again, a lot of focus knowing as much as possible about the patient's current status and their prior care to help determine the most appropriate treatment and post-discharge plan, as well as partnering effectively with other providers, which includes improved communication and also engagement with post-acutes. Next slide, please. And of course, these payment changes and shift in the overall system aren't only impacting hospitals or newer entities like accountable care organizations. They also impact skilled nursing facilities, which all of you know extremely well. There's the new patient-driven payment model impacting how SNFs are paid, the value-based purchasing program, which now has associated penalties for the 30-day readmission metric, the SNF quality reporting program, and of course, the very recent COVID-19 testing and reporting requirements that CMS has implemented. I'll spend a minute on the COVID-19 in particular on the next slide, given how pressing the topic is. And of course, these programs and payment mechanisms are nothing new to most of you here today, but they highlight specifically for SNFs that an ongoing shift toward more value-based care is significantly underway. And over the next few slides, we'll discuss more about how you can continue to be successful and thrive in this ever-changing environment. Next slide, please. So as mentioned, I wanted to spend just a minute or two on COVID-19 before we really start talking about the path to a successful future. I wanted to just take a minute to acknowledge the extremely challenging work all of you have been doing trying to manage through and operate during this pandemic. The challenges are real and vast, and some of the media attention has not necessarily been very favorable to nursing homes. I know one of my best friends is an NHA at a large facility in Maryland, and speaking with her, it's clear how heartbreaking, frustrating, and really stressful all at the same time things have been. Managing COVID patients, retaining staff, and keeping staff safe, secure in PPE, keeping up with constantly changing federal, state, and sometimes even local reporting requirements, keeping families informed while they can't visit, keeping patients safe, and also managing referrals at the same time is a lot to take on, and I'm sure all of you have gone through these extreme challenges over the last several months. And we hear stories from our SNF customers all the time as they try to manage their censuses in ever-changing requirements and protocols. And in the end, really similar to the overall shift to value-based care, managing in a crisis will continue to be challenging, but can be supported with better, more real-time information about patients and about resources to provide better ability to plan and organize your operations. And so we want to spend the rest of the time really focused on that, on the importance of information and using it to the most effective way possible for you and your organization. Next slide, please. So, of course, all of you want to ensure a successful future, operate in a way that's efficient, provide excellent patient care and services, and ensure your financial success. So we'll spend the next few slides taking a look as to what's ahead and how you can prepare for success, in particular using real-time data and notifications. Next slide, please. So what are some of the things we know about where we're going and what's ahead? Of course, there's continuing need to manage through the pandemic and then adjusting to the new post-pandemic normal. As I already mentioned, we've seen an ongoing increase in value-based care. For example, as published in Health Affairs as part of the Q3 2019 data, there were around 44 million covered lives nationwide who were attributed to accountable care organizations. 50% of those were commercial, 45% Medicare, 5% Medicaid, and those numbers continue to grow. CMS is coming out, in addition to the accountable care organization models, with even more models like the direct contracting model, and all of those really place emphasis on the coordination and communication, and above all else, an ability to successfully manage and treat patients with excellent quality outcomes. And related to that point, there'll continue to be an expansion of cross-continuum partnerships be it preferred network, special 3-day rule waivers for affiliated SNFs, perhaps more non-traditional partnerships with community resources that really help patients stay healthy beyond the SNF stay. And finally, more technology solutions to help you manage within the new environment and that provide tools to administrators and also frontline staff to enable success. For example, some of the risk stratification tools that are on the market, on-call providers that support remote patient monitoring, and tools to support patients' care pathways. I'm sure you know or use many of those kind of in your daily operations and hear about them kind of day to day too. So let's go to the next slide and talk about some aspects of actionable real-time data. So underpinning really a lot of the success within value-based care and the value-based care environment and operating within the current crisis more successfully is really having access to real-time data, particularly through notifications and added patient context. And really not just a lot of real-time data coming at you that you have to first sort through, figure out what it means, spend time making sense of. I imagine you're already busy and don't have time and don't want to be inundated with useless or kind of overwhelming information that takes a lot of time to analyze and to determine what really matters. But rather, really the need is there and the opportunity is there for actionable data that's useful in the way it's presented and in the way you and your team can consume it more effectively and efficiently. Also, it's important that the data can be customizable, meaning you have prioritized and focused ways of looking at what you really want and need. Access to that kind of data lets you plan for patient referrals and allows you to better manage patient once they're actually in your facilities. And that also includes COVID patients, of course. And we'll talk about how such data is beneficial in the next slide. So next slide, please. So really having access to real-time data and really making that actionable can ensure financial and operational success in 3 main categories. First, in your performance. It can help you in real time assess how you're doing on readmissions that impact your quality of care. You can also use the data to drive pullbacks to your facility, avoiding readmissions altogether. And based on that information, you can really use it to help assess your internal processes and structures to see how you can address contributing factors. You can use the data you receive on patient care history, including knowing whether a patient is COVID positive, as well as know about other providers they've had to more efficiently plan and coordinate with others across the continuum. It helps on the safety front and also saves time for your staff and minimizes phone tag, even faxing if that's still in play, and other processes that can really lead to a lot of frustration and time delays. It can also help you with your star ratings with CMS, which again allows you to highlight your success, form perhaps more sustainable and successful partnerships with acute providers or other providers in the community, and receive fewer penalties. And the second consideration is contracting. So as mentioned, star ratings and performance are often used by accountable care organizations, for example, to determine network status and referral relationships, which again impacts your census, volume, and overall stability. Data can help you form new partnerships and enter into financial arrangements to which you can manage much better by having access to information. You'll be able to use leading indicators to make changes and help your team be really successful. And the third category, and very importantly, is patient care. Patient satisfaction is much higher when patients know and experience true coordination among providers. When they don't have to repeat their entire histories every time they see a provider, when you already know who their other care teams are and what programs they might be enrolled in. Data allows you to know about the other care providers associated with the patient to give you better tools to coordinate care and to manage seamless and safe transitions of care as well. Information gives you a leg up, and really real-time and actual information and notifications even more so. Next slide, please. And let's end this section just on a few more ways you can take advantage of data to ensure your ongoing success and level of excellence. CMS recently released 2 hospital condition of participation requirements that you may have heard of. The most recent one is from March of this year and requires hospitals to send electronic patient event notifications to patients, providers, including post-acute providers, whenever shared patients are seen in the ED or admitted or discharged from an inpatient setting. This condition of participation is focused entirely on care coordination across the continuum of care, really enabled by data and information sharing. So again, it's another accelerator for change and your ability to manage patient care better through more information. The other COP, the second one, was the discharge planning rule, which was released just about a year ago, September of last year, which requires hospitals to provide post-acute performance data to patients and their caregivers prior to discharge from an inpatient setting to help patients choose a provider. So you want to be, of course, a highly rated provider, meaning good star ratings, to ensure that patients choose your facility. Again, being a high performer is easier by having data and acting on it and really driving your operations and how you manage patient care. It'll support your quality of care initiatives as well as the patient experience. And then finally, the value-based purchasing program, of course, focuses specifically on readmissions, and knowing how and when and through what mechanisms patients readmit is critical. Also, diverting patients back to you when they show up in the ED and avoiding a readmission that way, wherever clinically appropriate, can really help your performance significantly. And all of this is to say that having actionable information is critical now and even more so going forward as things continue to shift. The great news is that information is indeed accessible and you have a great opportunity to use it to help support and ensure your ongoing success. And I'll now turn it over to my colleague Anthony, who will cover some of the real-time data solutions we've developed and that have been adopted by providers all across the country. Anthony, please take it away.
Thanks, Vanessa. As my colleague Vanessa just outlined, SNFs have to weigh a lot of key factors while determining their strategies going forward. As the payment landscape continues to shift in favor of best clinical outcomes, successful operators are acutely aware of the value of real-time information, in particular admission, discharge, and transfer notifications, and even more so in the midst of COVID-19. There are several key areas where operators can focus their efforts to provide care that best fit each patient's need while ensuring their financial and operational success. So over the next several slides, I'll go over how SNFs can leverage real-time notification solutions as they navigate the ever-changing environment. First, let me give a brief background, an introduction as to who we are and how we got our start. So our CEO, Jay Desai, he used to work at CMS, the Innovation Center, as part of their developing ACOs, bundle payments, and other new value-based care models. And he's considered to be one of the early architects of value-based care models, such as ACOs and bundles. And so if you go back to those earlier ACO years, so 2010, 11, 12, Jay was going cross-country, speaking with all the pioneer ACOs. And there was a common concern, a criticism, a reoccurring theme of the model, which was, how are we supposed to provide this type of care if we don't know where our patients are in real time? And this was a light bulb moment for Jay, and he soon left CMMI and started PatientPing in 2013. And so our mission as a company is to seamlessly connect providers to coordinate care for their patients, and here's our vision. A connected community of providers across the continuum, which includes hospitals, SNFs, home health, large health systems, other post-acutes, community providers, FQHCs, HIEs, health plans, behavioral health organizations, and more across the nation, regardless of the EMR that they use. So whether you're on PCC, Matrix, NetSmart, AHT, Devero, Home Care, Home Base, or you're a health system on Epic or Cerner or Meditech, you can be part of the PatientPing network to help enable healthcare communities to reduce the cost through higher quality patient care and coordination. Next slide, please. So let's take a look at our network today. So we have the most robust national network across the continuum, composed of over 1,000 hospitals, over 5,000 post-acutes that contribute their ADT to the network to enable e-notifications to be sent to their care partners. And this slide is ever growing as we continue to add new entities to the network on a weekly basis. Our network contains vast amounts of ACOs, post-acute providers, and primary care groups who not only contribute data to the network, but they also rely on us. They rely on PatientPing to receive e-notifications for their patients to optimize encounter efficiency, ensure in-network care continuity, and reduce avoidable utilization. And we do this through pings and stories. Another name for stories you might hear me say is patient profiles. Next slide, please. So at our core are pings and stories. So let me walk you all through how it works. So let's say a managing provider, such as an ACO, they would provide PatientPing with a roster of their at-risk patients with demographic information, and it's usually done on a monthly cadence. And when one of those patients admits to one of the thousands of SNFs we have on our network, remember we're connected through those ADTs, the second that admission coordinator hits F12 and admits that patient into PCC or matrix care, in real time, we're going to send an alert, we call them pings, to that ACO and their care coordinators who are responsible for the cost and outcomes of that patient's care. And we're going to let them know that one of their patients in real time just admitted to SNF ABC. And the information is bidirectional. So not only are we going to alert that ACO, that managing provider, that one of their patients was just admitted to SNF ABC, we're also going to send what we call the patient story, or that patient profile, to that admitting facility within a few seconds of them hitting F12 and admitting that patient into their EMR. So we're going to give them context about that patient, relevant information for them to help develop the proper care plan. So they're going to know program attribution. In fact, whose patient did we just admit? And is that patient part of any subset programs within that ACO, for the example? Diabetes programs, high-risk CHF cohort. We're going to provide care team information. Who do you need to call if you need to get information about this patient? PCP information. We're going to provide you full visit histories of wherever that patient's received care prior to that patient admitting to your facility. So when, where, how long, and what the admitting diagnosis was for any healthcare events prior to you admitting that patient. And lastly, we're going to provide any care instructions that managing provider would want the admitting facility to know for their cohort of patients. So high-level admission or discharge instructions. And just how we monitor patients for ACOs, POs, and health plans, we can do the same thing for SNFs. So we can monitor all patients admitted to your SNF for the length of stay that they're under your care, plus a window of 90 days post-discharge. And so what's the value added for the SNF? So let's say a patient is discharged from an inpatient setting to your facility, and then you discharge that patient after a 14-day stay, either back into the community or to one of your downstream partners. There's still a window of 16 days where if that patient readmits to a hospital anywhere in our network, your facility is going to be penalized. Many SNFs today are unaware of what happens to their patients post-discharge. But with PatientPing, we will send real-time alerts or pings when a former patient presents to any ED on our network. So members of your staff, your liaisons, admissions coordinators, can be alerted via text or email, letting them know that a former patient is sitting in an ED somewhere on the network. Your team can then reach out to the ED, find out what's going on with that patient, and if that readmission is preventable, divert that patient back to your SNF. You'd be avoiding a financial penalty to you and your SNF and reducing the cost of care for that ACO that referred you that patient by preventing that rehospitalization and bringing that patient back to the more appropriate, lower cost of care setting. Patient retention is another area where real-time notifications can be extremely helpful. And for example, if you had a patient that was admitted to your center with COPD diagnosis, and after a few weeks stay, that patient had discharged successfully to the community, if that same patient has another healthcare event completely unrelated to the previous stay of diagnosis of COPD, say that patient fell and fractured a hip, your team would be notified when the former patient was in the ED, and then again when they were admitted into the inpatient setting. So remember, we're going to send you pings for that 90-day window post-discharge. So with this type of real-time notification information, you can reach out to the family if the relationship is there from the prior stay and say, hey, we know that your mom's back in the hospital. When she's ready for discharge, we wanted to let you know that we have a bed ready and available for her. You can also reach out to the case manager on the floor at the hospital where that patient's currently admitted. Let them know that this was a former patient of yours just a couple of months back, and then that you have a bed available when ready for discharge. You're ensuring that former patients that had good outcomes and experiences, that were happy with your services and care, come back to you in your SNF rather than going to a competitor. Next slide. For SNF chains of any size, we offer an analytics dashboard that gives a holistic view of all of your centers that are receiving pings and allows you to drill down to patient-level information in just a couple of clicks. So there are 3 dashboards. One that monitors missed care opportunities, another readmissions, both directly from your centers as well as readmissions from the community, and lastly, an ACO collaboration dashboard. All of which, because the ADTs are connected, are updated daily in real time. I'll briefly walk you through all 3. At PatientPing, we define a missed care opportunity as a patient that had a care relationship with your SNF, and within that window of 90 days post-discharge, that we allow SNFs to monitor patients admitted to one of your competitors. Knowing this information gives you the ability to look for and understand trends and do root cause analysis as to why your patients are out migrating from this particular SNF and to these particular competitors in this specific area. Our readmission dashboard will separate your 30-day readmissions into 2 buckets. Your readmissions from your SNF, which you're likely aware of, but then separately, we will show your readmissions directly from the community and your downstream partners like home health. As SNFs are continuously asked to discharge patients more quickly, it's very important that SNFs have the right downstream partners. And so just how ACOs have their preferred networks, SNFs should really think about building out their own. We allow you to tighten your downstream network and make sure that you are discharging your patients into the hands of quality partners. And if they're not quality partners, maybe it's time to look for new downstream partners. And the third dashboard is our ACO collaboration dashboard, or a source of truth between our post-acute and our ACO partners. So this is the same dashboard that our 200 plus ACO partners have access to. So shared data on shared patients to help your organization streamline performance reviews with your hospital and ACO partners at your monthly and quarterly meetings. So this is easy access to patient referral volume, length of stay, and readmission data between you and your referring partners. Next slide, please. In addition to our smart flags, that identify high utilizers, which which are patients that have had 3 or more ED visits in the last 60 days, and patients that are at risk of readmission, meaning a patient or patients that are currently sitting somewhere in the network in an ED or observations that had been discharged from an inpatient setting within the last 30 days. We recently developed a COVID-19 flag to help identify current, former, and potentially returning patients that can be presumed positive for COVID-19 by pulling information from these ADTs. So once you're notified that a former patient could be COVID-19 positive, SNFs can take the proper steps for contact tracing, adhering to quarantine protocols, properly allocating already scarce PPE, and to help ensure the safety of your staff and patients. Next slide, please. So in summation, the value of real-time notifications to SNFs are as follows. The ability to strengthen your ACO, managing provider, and community provider partnerships. The ability to apply timely interventions to avoid unnecessary readmissions. Identify missed care opportunities to optimize workflows and to increase patient retention. Protection of your staff and patients, and allocating the PPE and quarantine protocols when necessary because you have that right information. And lastly, build your own preferred downstream network with the right partners. Next slide, please. PatientPing is a trusted vendor for helping SNFs succeed in a rapidly evolving landscape based on the strength of 3 factors: our network, our products, and our team. We have an absolutely world-class team of company leaders, board members, and advisors with deep experience and expertise in policy and interoperability, with prior experiences at organizations like CMS, Commonwealth, and Epic and Cerner. With a robust and always growing network, strong product suite, and world-class leadership, a partnership with PatientPing can help you be successful today, support you in your operations throughout this pandemic, and ensure that you have the tools needed to help you thrive in the years ahead. Last slide, please. So lastly, for anyone interested in access to additional information, or if you have questions and would like to speak with someone from our team, please don't hesitate to reach out. Us pingers are looking forward to speaking with you. Looks like we have some time left in the hour to answer questions. So I'll reiterate what Vanessa said earlier. Feel free to submit any questions that you have on the GoToWebinar control panel, and Vanessa and I will answer as many as we can. We're also going to be sending out a copy of the slides and of this recording following the webinar. Thank you.
Yes, thank you for that presentation. And now we can proceed to the Q&A portion of today's conversation. Again, to reiterate, please feel free to submit as many questions as you'd like. We have plenty of time to answer them. First question here, it's about HIPAA. How does HIPAA play into these patients when they enter the ER?
Hey, Alex. Yeah, I'm happy to take that question. Really good question. The notifications are covered under the PTO exceptions, the payment treatment operation, healthcare operation exception under HIPAA, as long as, of course, they're sent to another treatment provider or provider that has an established care relationship with the patient. So additional consent isn't necessary unless there are specific state laws that might be stricter than HIPAA, then those would come into play. But otherwise, HIPAA will cover the information exchange across these covered entities and across these treating providers.
Great. Obviously, a top concern. Good answer here. Thank you for that question. Question here about the VBP program score. I know this is something that's very important because it can result in penalties. It can also result in a boost. How does having these notifications, how does that play into the improvement of that VBP score, if that's something that's top of mind for maybe a leader at one of these nursing home companies?
Yeah, I'll take this one as well, Alex. As Anthony kind of pointed out in his part of the presentation, and I alluded to earlier, really you want to be looking at reducing your readmissions and really using the real-time data to know and assess kind of what might be contributing to those in the first place, so you can reassess your processes, protocols that you might have in place, and do that in real time. And also, as Anthony pointed out, you would be receiving real-time notifications when a patient that may have left your SNF is going back to the ED, and you can prevent the admission by really having that real-time information about the ED and pulling the patient back to your facility, as appropriate and as bed availability allows. But it can really give you kind of that real-time actionable insight and allow you to work with both the patient and kind of the hospital provider to get the patient back and avoid that readmission.
Great. Obviously, VBP is something that is really top of mind. It's not a huge amount of money either way, but obviously, given all of the stresses going on here in the industry, I don't think anyone wants to leave, a single dollar on the table, given everything else that's going on. Question here about COVID-19 patients. Obviously, it's another thing that is very important for operators in a lot of states. For Medicaid purposes, there might be a little boost for taking care of COVID-19 patients. Obviously, just something to keep track of in terms of reporting and making sure that everyone is staying compliant. Is there anything specifically that helps identify COVID-19 patients in the platform that you guys are talking about today?
Yes. So our COVID flag will be applied to patients who have had clinical encounters somewhere on our network that involve the specific COVID-19 diagnosis code U07.1. Another way is when COVID was first happened, the CDC released some guidelines on some ICD-10 codes that were symptoms, or diagnosis codes that were symptoms of that COVID patients had. So if one of those codes are present, plus or accompanied with some free text in the chief complaint that mentioned COVID, coronavirus, COVID-19, that would also trigger that flag.
Got it. And then I guess as a follow-up question, what can you then do with that information if you have that identification, on the ground? What is the sort of logistical benefit of something like that?
I think one of the ones is if you know you're having a patient that's going to be coming back to your SNF, and you know that they can be presumed positive, there's steps that you need to take, quarantine protocols, maybe finding a room isolated for a patient that can take that type of patient. Just prepare to make sure that you are doing everything you can to protect your staff and the other patients that are inside that center.
Got it. Now, zooming out a little bit more, just a question in general about, can you speak to any specific value-based care models or programs that are coming down the pike that might have implications for skilled nursing facilities? Obviously, we're in a lot of flux right now. CMS announced their payment rule for fiscal 2021, which is coming up in about 2 weeks now, and there really wasn't a lot of movement in terms of the value-based purchasing, the VBP program. They only made some small technical changes to that. Given everything that's happening with COVID-19, given all the other stresses, we didn't see a ton of change in sort of the standard payment rule. But obviously, I think COVID-19 is going to be a major driver of change, both in terms of regulations, in terms of compliance, in terms of fines, also in terms of payment models. So any sort of information or any just discussion of future-based care models that might be coming down the pike that operators should be aware of?
Yeah, Alex, I'm happy to take that one again. Yeah, you're right. With COVID, there's been some delays in new models that were really scheduled to be operational starting in 2021 that have been pushed out, a quarter or two. But we do know that the direct contracting model will launch April 1st of 2021. That is kind of the new ACO evolution, if you want to call it that, where again, the entity, direct contracting entity, will take total cost of care risk really at a high rate, 50 or 100% for their Medicare fee-for-service patients. And, that'll certainly provide some opportunities for operators to really partner and demonstrate their value and be part of kind of that preferred network. So I would definitely keep an eye out for that and determine if you haven't already who in your community has applied or will be participating in that. CMS also recently announced the Community Health Access and Rural Transformation Model, or the CHART model for short. Really, it's very similar. It's another ACO type model, but really focused on rural areas, rural populations, and bringing some of these value-based care arrangements and emphasis to those communities. So if that's kind of a location where you are, I would also kind of keep monitoring that. That'll be a little later than the direct contracting model, but again, a good one to keep an eye out for. And of course, there is kind of the ongoing Medicare Shared Savings Program. There won't be a new cohort in 2021, again, because of COVID. But certainly there are opportunities as of January 1, to be an affiliated SNF with some of those ACOs and to change your status there if that's of interest. In addition, the Kidney Care Choices model is another ACO type model for ESRD patients, and again looks at total cost of care, and we'll also be partnering with post-acute providers, in particular SNFs, for those patient populations. So I think there's quite a lot in the pipeline. Really, again, looking at that cross-continuum partnership and working really directly on managing patients, coordination, ensuring really seamless and safe transitions for those patients. So I think keeping an eye out on those and gauging kind of your interest in participating or partnering rather with those entities in your community will be really helpful and can really set you up for success going forward.
Yeah, just briefly, I want to follow up on the direct contracting idea, because that is something that, sort of in the before times, the last round of conferences that I went to before the COVID-19, there was a lot of chatter about it. There's a lot of interest about it. What are some of the big differences, with that model coming out? What are some big differences and maybe some big opportunities that operators might have that they don't have under the current system?
Yes, so there will be, so CMS has announced, additional waivers for that model, as has been the case, for example, for the next generation ACO, where there will be a 3-day waiver that will be available for affiliated SNFs. So you do have opportunities to bring patients to your facility without having that, 3-day hospitalization requirements. So I know that's really a big one. There are others around like home visits, and which may not really be particularly relevant to the SNF audience, but there are other waivers that will be issued that really try to promote as much like collaboration and coordination as possible, and kind of breaking down any barriers for patients and just making sure they have the best outcomes possible and receive the right care at the right time. But yeah, there are some additional waivers, and really encouraged collaboration across the different care settings.
Great. Obviously some stuff to look forward to in the future. That looks like that's it for the questions on our end. Guys, do you have any closing thoughts before we wrap up here?
Yeah, I'm happy to just wrap it up. Thank you again, Alex, for the opportunity. Anthony, as Anthony mentioned, we have resources on our website that you can see on the slides. Feel free to reach out. We really appreciate your attending today and listening to all of the opportunities that are out there with the information that's available. And yeah, hope you have a great rest of your week. And thanks again for participating today.
Yes, thank you so much for taking part in today's presentation. Quick reminder, you will get a copy of the slides as well as a recording of today's presentation at the email address that you used to sign up for today's webinar. Thanks so much. Hope to see you again soon on our next Aging Media Network webinar. Take care, everybody.